We all know that sound. That high-pitched whine of the dental drill is a universal symbol for anxiety. For many, just the thought of a filling is enough to make their palms sweat. But what if that fear isn't really about the procedure itself, but about the unknown? What if you knew exactly what was happening in your mouth, and why every strange tool, every blue gel, and every bright light was being used? This is not just another dental video. This is the definitive, step-by-step guide to a dental filling, designed to eliminate your anxiety by replacing it with knowledge. We are going to demystify the entire process from the moment you sit in the chair to the final polish. By the end of this, you will understand the science. You will know the procedure, and you will be able to walk into your next dental appointment with confidence instead of fear. 1. The hidden enemy. Why the in-between cavity forms. Before we even get to the dentist's chair, let's talk about why you're here. You were told you have a cavity, specifically one between your teeth. This is the most common and most frustrating type of decay. You might think, but I brush. I don't eat that much sugar. The truth is, these interproximal cavities are caused by a hidden enemy. It's not just sugar, it's what eats the sugar. Your mouth is home to billions of bacteria, and some, like Streptococcus mutans, are tiny acid factories. When you eat anything carbs, sugars, these bacteria feast on it and produce acid as a waste product. This acid is what eats away at your tooth's enamel. The space between your teeth is the perfect, sheltered neighborhood for these bacteria to build their homes, which we call biofilm. Brushing can't reach it, and if you don't floss, that biofilm sits there, producing acid 24/7, eventually creating a hole. This is the cavity. Our goal today isn't just to fill a hole, it's to evict this acid-producing colony and rebuild your tooth's fortress. 2. The preparation. Getting numb and comfortable. The first thing you'll notice is the preparation. You might even have your blood pressure taken. This isn't just for fun, it's because the most common local anesthetics, the numbing agents, contain a small amount of epinephrine, adrenaline. This is a good thing. It makes the anesthetic last longer and reduces bleeding. But for safety, your dentist checks your blood pressure to ensure it's a safe option for you. Now comes the part we all dread, the needle. But a good dentist follows a process to make this almost painless. First, they will dry the area and apply a topical anesthetic. This is that fruity-tasting jelly. It's usually benzocaine, and it's designed to numb the surface tissue, so you don't feel the needle. After a minute, the tissue is numb, and you are ready for the local anesthetic. This is the secret to a painless injection. Your dentist will inject the solution slowly. It's not the needle itself that hurts, but the pressure of the fluid expanding the tissue too quickly. As that anesthetic, like lidocaine or articaine, flows in, it gets to work. It's a sodium channel blocker. This means it stops the nerves in that area from sending pain signals to your brain. You'll feel pressure, you'll feel vibration, but you will not feel the sharp sensation of pain. In 5 to 10 minutes, that area of your mouth will be profoundly numb. 3. The procedure, removing the decay. This is the part that causes the most anxiety, the drill. But let's reframe it. The drill is not an instrument of pain. It's a precision tool for removing a microscopic infection. First, you'll hear the high-speed handpiece. That's the high-pitched whine. This tool spins at up to 400,000 RPM and sprays a constant jet of water. People think the water is just to rinse, but its main job is to cool. The friction from that speed would generate intense heat, which could damage the tooth's nerve or pulp. The drill and the water jet work together to gently and safely remove the weak, decayed enamel until the dentist reaches the softer layer beneath, called dentin. Once the dentist is in the dentin, they may switch tools. You might hear the sound change to the low-speed handpiece. This one is often called Mr. Bumpy by pediatric dentists. It sounds slower, more like a low rumble, and it doesn't spray water. Its purpose is finesse. The dentist uses this to carefully remove only the decayed, mushy dentin, leaving all the healthy, solid tooth structure behind. Your dentist may also use a caries detector green or red liquid that they paint on, rinse off, and it only stains the decayed parts. This is how they can be 100% certain all the infection is gone before they start rebuilding. 4. The rebuilding, the art and science of the filling. Now that the bad part is gone, the tooth is clean and ready to be rebuilt. For a cavity between the teeth, this is where the real artistry begins. Step 1. The band and wedge. Your tooth now has a hole in its side, but a filling needs a box to be packed into. So, your dentist will slide a thin, curved piece of metal called a matrix band around the tooth. This band becomes the new wall of the tooth. Then, a small wooden or plastic wedge is pushed gently between the teeth at the gum line. This wedge does two critical jobs. It seals the bottom of the box so no filling material can leak out, and it slightly separates the teeth. This is crucial because when the band and wedge are removed, the teeth will spring back together, creating a perfectly tight contact. This is what ensures you'll be able to floss again. Step 2. The etch and bond. You will see your dentist apply a bright blue gel. This is the etch. It's a 37% phosphoric acid, and it's the secret to making the filling stick. It's applied to the clean tooth surface for about 15 seconds. On a microscopic level, this acid creates tiny, tiny pores in the enamel, making the surface look like a honeycomb. This is the Velcro. After it's rinsed and dried, the dentist will paint on a thin liquid called bonding agent. This liquid flows into all those tiny pores and is then hardened with a special light. This bond is the glue that will chemically lock the filling to your tooth. Step 3. The composite. Now, the filling itself. That tooth-colored, putty-like material is called composite resin. It's a mixture of a plastic resin and microscopic glass or quartz particles. Your dentist will apply this material in small layers. Why layers? Because the curing light can only penetrate and harden about 2 millimeters of the material at a time. This layering technique ensures the entire filling is rock hard, from the bottom to the top. After each layer, you'll see the curing light, that bright blue light. The light activates a photoinitiator in the composite, starting a chemical reaction that hardens the material in about 20 seconds. 5. The finishing touches, the perfect bite. The filling is now hard, but the job isn't done. The dentist will now remove the wedge and the matrix band. Now, for the most important part for your comfort, the bite check. Your mouth is still numb, so you can't tell if the filling is the right shape. You can't be trusted. So, your dentist will use articulating paper. This is that thin, blue or red paper they have you tap 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 on. Any spot on the new filling that is high will be marked by the paper. A high spot is a serious problem. It takes all the force of your bite and can lead to sensitivity, pain, or even a cracked tooth. Your dentist will use the high-speed drill or the slow speed with a fine polishing burr to gently remove those tiny high spots. Have you tap again and repeat the process until the paper leaves no marks or marks that are equal to your other teeth. Finally, they will use a series of rubber points and polishing brushes to make the filling perfectly smooth and shiny. This isn't just for looks. A smooth surface is harder for that bacterial biofilm to stick to, making it easier for you to keep clean and preventing a new cavity from starting. And there you have it. The procedure is over. You've seen every step, from the hidden bacterial enemy to the final high-gloss polish. That strange noise is just a cooling spray. That blue gel is just Velcro for your tooth. By understanding the why behind every step, the fear of the unknown disappears. So, I have a question for you. What part of this procedure surprised you the most? Was it the caries detecting dye? The matrix band? Let me know in the comments below. And if this video helped you conquer even a little bit of that dental anxiety, Share it with someone you know who needs it. This is how we replace fear with knowledge.